Okay, everybody, that was a fabulous song by Miss Aretha Franklin. Rest in peace, Aretha Franklin. And we're here with the Let's Talk Life show. This is the health segment, and we have a wonderful guest who is the Regional Vice President of United Healthcare, Mr. Todd Macaluso. Hello, Todd.
Hello, thanks for having me.
Oh, you're so welcome. Thank you so much for taking the time to come to the Let's Talk Life show.
Glad to be here.
Oh, yes, we're so happy to have you. And we're going to get a little bit of information about Todd and about United Healthcare. But at first, we're going to sip a little tea, which is discuss some current events. And what we're going to talk about is all the hurricanes that are happening all across the country. And you know, we just want to give our condolences to anyone who's been affected by the hurricanes. Todd, hopefully you don't know anybody.
Not directly affected, but it looks pretty devastating.
It is. And, you know, we hope that everybody's getting the relief they need, and we just want to give our prayers and condolences out to them. But right now, what we're going to do is take a little time to get to know Todd and what he does as an executive for United Healthcare. So just share with us a little bit, Todd.
Great. Well, I've been with United Healthcare 11 years now, and I started in the insurance business because I did a number of different things, but found out that people actually wanted to talk to me about health insurance. Everybody has concerns, right? You know, how much medications cost or what the coverage is going to be like if something major happens. But I joined United Healthcare about 11 years ago, and everything from training agents and showing agents how to represent our company and how to do things right, how to help people enroll and choose the best plan that meets their needs. So now I work with a number of different sales teams throughout Arizona, Colorado, New Mexico, and they're doing the same thing, kind of getting out there, helping agents learn how to do things right, and educate folks, learn what healthcare is right for them, specifically in their senior years and their retirement years. Most of the people that we serve are 65 and older, and these folks really need our help. You'd be amazed to see, you know, how many questions and how much confusion there is out there. So we're really there to educate first, and then secondarily we help people live healthier lives by getting them right on the right kind of plan at the right time.
I love it. I love it. And I'll just give a public service announcement that I am an agent contracted with United Healthcare. And I just want to say how, you know, what kind of great service that you guys really do provide my clients.
Yeah. Well, we're glad to have you, Letitia. So it's people just like you know, that are out in the community, that care about people, that are willing to have patience to sit down with folks and, you know, figure out what their needs are, save money or get coverage they didn't even know they could have. So we need people just like you across every community to be out there representing our plans. You know, many of our plans are good news, or the education we give is good news to people where they're saving money and finding that they can actually get access to health care where they thought they couldn't. And it's really life-changing. So we need people like you. We're proud to have you representing us.
Oh, thank you so much. Thank you so much. And, you know, I mean, that's just a big passion that I have for the senior community, to first and foremost educate them, you know, about their options that are available to them. Maybe they qualify for different things, and just how to get, you know, decent benefits. Because sometimes healthcare can be a little shaky in this day and age. So when you can get some quality care, that's really important.
Absolutely.
Well, I know United Healthcare is very active in the community, and they do a lot for the community. So can you give us just a little information about some of the programs?
Yeah, there's a lot of things that United Healthcare gets involved in. It's really makes me proud to work for the company I do work with. So United Healthcare is a very large organization, and the United Health Foundation is really active all across the country, and they do all kinds of things with you know, homeless shelter charities, children's foundations, all kinds of different groups where they're giving back, and so we're always trying to link local organizations to our foundation. So there's a lot of really good work that goes on with veterans associations and others. So United Healthcare does a ton, and they're actually the largest health insurance company in the country, and they give back a lot. So that really is nice to know that we're doing that charitable piece. And then locally, some of the stuff we do, you've probably even seen some of the things that our Smart Community Division gets involved in, working with local organizations or charitable causes to, you know, give back to people that need it. it's homeless folks or people that have limited income, involved in food drives and food pantries and other things. And these are the types of people that we're also helping with make sure they have quality health care. And many of them didn't even know they could access it and be going to a high quality doctor just like you and I go to. And so there's a lot of things we're involved in. It's everything from lower income communities all the way up to being involved with other organizations that are serving all types of individuals in retirement.
I really love that. And the thing that I like the most about United Healthcare, and like you said, you guys are one of the leading insurance carriers in the country, as well as the state of Arizona, is the fact that even though you're so large, you still have a personal touch. Right. You guys are still somehow able to give like 5-star service. I don't know.
Yeah. Well, that's one of the neatest things. And working for United for a long time now, a few years ago, I really could see what we were doing behind the scenes. That we're not good because we're big. We're big because we're good. And if we're gonna be the largest health insurance company, we need to keep it personal. And so United's been doing a lot of really great things to make sure we keep it personalized, we keep it individual. All kinds of things I could share about how we've just transformed. Even when you call into customer service, you know, the number on the back of my ID card, you call in, you get a next level service. And years ago, it wasn't like that. So if we're going to get big and we're going to be serving that many people nationwide, we better be personal.
I mean, I think that's really a tough battle that, you know, a lot of insurance carriers struggle with is like the growth, how to handle the growth. Mm-hmm. And sometimes when they rapidly expand or rapidly grow, then the quality of service rapidly declines. Right. But I just want to say, as an agent and, you know, dealing with so many clients, that you guys really give 5-star service to me as an agent, first of all, but most importantly to my clients. I just want to share a nice story with you. I had a client that I had signed up, you know, for a United Healthcare plan, helped her save some money, you know, get her some new benefits, and like a week later, she literally had a stroke. Mm-hmm. She literally had a stroke. She couldn't talk. She just, you know, had to go through the whole motions, and United Healthcare, like, took such good care of her. And I was just so happy that I had, you know, was able to provide her with a new plan, and for her to get that service. You know, the doctor came to the home. They were doing follow-up calls, United Healthcare, to make sure everything was fine. They were able to work with her daughter to help with the paperwork. So it was just really a seamless transition, and I was so thankful, because that's the worst thing you want to do as an agent, is place somebody into a plan and then they get horrible service or some type of emergency occurs and then you regret, like, you know, switching them or anything like that.
Absolutely. So one of the key topics that we always talk about internally is how do we make sure we're distinctively different in a good way. I met a gentleman a couple weeks ago who was on one of our Medicare plans, and he was diagnosed with prostate cancer. Really big, life-changing event. What happens now with United is that we've transformed our customer service model where they don't care how long they spend on the phone with you, and we've transformed that years ago. Now, this gentleman that was diagnosed with cancer, he's got one point of contact at United Healthcare through this whole ordeal. So the peace of mind he knows now, if it's getting referrals or setting up screenings, have follow-up exams, whatever it is, right? Chemotherapy, all this stuff is handled through one person at United Healthcare. And there's no other company that's able to do that. It's because of the things that we built over the last 4 or 5 years and the culture change we had with customer service. So it's really neat to know. It's like, yeah, I know where I want my parents to be. You know, if something bad were to happen to them, they're going to get that next level service.
Well, I think that it's so funny that you touched on that, because that's the problem, is especially when we're dealing with CMS, Medicare, we have such, you know, guidelines, strict guidelines that you have to work within. So being able to kind of adjust your business model so that you're still able to provide, you know, like a one-on-one or you know, just be able to service the customer in that type of way. Because again, when you know, our clients are dealing with life-changing events, they're like, well, I can't get a hold of my doctor, I gotta get a referral, I can't do this, I can't do that. And who can think about that when you're trying to deal with stage 4 cancer or you just had a stroke? Right. So I really am impressed that you guys have implemented that. I haven't heard that, you know, with any other carrier, so absolutely. That is amazing.
Yeah, it's called Navigate for Me, so it's exciting You know, it's not available to every single person, but those members that have a life-changing event, it's something new. I think it's, as there are a lot of regulations and there's a lot of things that we find out we can't do.
Right.
What United Healthcare's done a good job is figuring out what are those opportunities, what should we be doing. You know, it's not just sickness insurance anymore. It's truly a healthcare experience.
For sure.
And so they've turned a lot of great programs into, you know, real results now.
I love that. I love that. Well, you guys, we are honored to have Mr. Todd Macaluso here with us at the Let's Talk Life show. We will be back with him and some more information in the next segment. We'll see you soon. Alrighty, welcome to the next segment of the Let's Talk Live show. We're back here with Mr. Todd Macaluso, and we were just kind of discussing some of the services that United Healthcare has been providing to the community. I know you were just sharing that great new program that you implemented, but that's what I kind of want to touch on, are some of the things that differentiate you guys' Medicare Advantage plan from maybe some of the other ones that are available, because I will tell you, and I mean, you know, since we're in the industry, we know that everyone has to provide the basic Medicare A and B, you know, medical services
Sure.
and things like that. So then it's like, okay, if everybody has at least the basic benefits, what does a company do to differentiate themselves? You know,
Absolutely.
what does a company do to set themselves aside from the other 5 or 10 that are here in the state or whatever? So you can kind of just maybe highlight on some of that. Mm-hmm.
Yeah, well, there is definitely an important piece to look at is what company are you enrolling with? If you're going to trust your health care, especially when you're in retirement, maybe you're on a more fixed income. So the reputation of the company you're enrolling with really does matter. So it's not all just about prices, you know, well, this is $5 cheaper for the doctor versus this. But when you step back and you look at, well, how long has the plan been available in this area? You know, United Healthcare has a really long tenure. They've been helping with the same plans for many, many years in this area and across, you know, the country. So that financial reputation of the company is really important as well. United Healthcare is all in on Medicare. We're not going through any mergers. We're not worried about any disruption there. Or many of the other carriers, it's like being purchased by retailers. People are trying to catch up to how large United Healthcare has become. So there's a big financial stability there, which means that the plans don't change year over year. They, you know, might be some slight adjustments, but when our members join our plans, they're usually seeing good news every year to find out what's changed for the next year. We're nice and consistent, so that up and down worry is out the window with United Healthcare. And
I just want to touch on that really quick, because oh my gosh, the fluctuation in the market is so devastating sometimes. And it's really sad, because I feel like when the insurance carriers are going through their financial issues, their contract issues or whatever, it's the client who has to suffer. You know, I'm the one on the other end hearing the client say, you know, they don't cover this now, or oh, my doctor's not here, or oh, the price is significantly increased. And I'm just so happy to know, you know, first of all, United Healthcare's longevity, and second of all, their stability.
Right.
Because that is so important.
Right. And we're always planning for long term. So we don't make plan benefit decisions for the next 12 months. We're making plan benefit decisions for the next 5 years. So I'm not going to do anything or take some risks that we need to do if we have to take it away or make a big change the following year. That's just nice to know. It's when you choose your health insurance and Medicare stage of your life, you don't want to have to change it all the time, and you don't want to be worried. So you're going to have more consistent quality health care because you have the same providers, you have the same, you know, coverages, you have the same experience when you go to the pharmacy, or you have the same ID card. It just makes everything work. And if you change it every year, you're not going to have that head start. So you really get a head start with United, just that solid, consistent, you know, plans that we've been able to offer. And then, you know, one thing I just thought that we hadn't even touched on too is the network stability and how the breadth of your network. There's some plans out there that offer something shiny and it looks good,
Right.
but they don't have that reputation that United Healthcare does to contract with doctors. So, you know, the physicians want to contract with United Healthcare. It's not only, you know, reputable for folks that represent our plans as agents like you. It's not only important for the members because they know they can count on us when they need us, but it's important the providers look at us as, man, if I have United Healthcare, that's a solid insurance company that I'm working with.
For sure, and you know what is so funny because like all my United Healthcare clients are loyal. I'm like, oh, well the copay went up, you know, $5, $10, whatever. You know, this might have gone up $5. They're like, I don't care, it's okay.
Yeah.
You know, they don't care because they know that they're gonna get the service, you know, that they deserve and the service that's been tried and true. And I mean, you know, I just like to hear all of the political things that go in the background, like you said, because you're an executive, so you can kind of touch on the back end in terms of the provider contracting and things like that. Like people are like, my doctor just randomly stopped accepting this insurance, you know, in the middle of the year, whatever, and it just really causes so many issues. So I think that, you know, whatever you guys are doing to keep the providers happy is really key, and that's a business element that maybe some other carriers might be missing because people are tried and true. They're married to their doctor.
Absolutely.
They're like, they, you know, delivered my 3 kids. I've been having them for 20 years. So they will switch insurance based on the provider. And it's like, you know, if they know that, hey, my provider's happy, they're not going to be having these political wars in the background with the carrier. It's so important.
Yeah. There's been a lot of changes on the provider front. You know, doctors don't do the things they did 10 years ago. It's much different. So one of the biggest things is quality. So we're being forced to by Medicare and by CMS to make sure that we're offering quality, not quantity, and that there's real value in our plans that goes above and beyond original Medicare. And then that quality and those value themes get passed down to the providers. So we're working hand in hand with the doctors to make sure that they are closing gaps in healthcare. You know, find anyone that they have coming in or as a patient that's diabetic, making sure, hey, how are we getting these folks to get healthier?
Yeah.
And we're incentivizing doctors to do that. Mm-hmm. So we've got all kinds of great programs where we help incentivize the doctor's office, your local doctor, to help incentivize them to take better care of their patients. So it's a win-win-win across the board.
Exactly, because I feel like it doesn't matter, you know, how much a provider likes an insurance carrier. As soon as they have problems with their payment and they, you know, all these things, they're like, oh, I can't accept them, and it's just...
They've been asked to do so many things that so providers generally really like working with United. But it's a long-term partnership where we're focused on helping their patients get healthier over the long run, and incentivizing the doctors for quality, and the doctors that really are long-term focus as well. We have shared goals.
I love that. So, you know, I'm just happy to hear about all the great things that United Healthcare is doing and what they're doing to also proactively keep it that way in the future.
Absolutely. It's all about stable network, stable plans.
I love it. This is great. So let us discuss a little bit about some of the plans that may be available, or, you know, we can't really get into a lot of detail, and that's fine, but I do just want the community to be aware of some of the really, you know, the options that you guys have available.
Well, now's a good time to be thinking about it, because this is the annual enrollment period right now. It lasts all the way till December 7th.
Yep.
And that's the one time a year where someone on a Medicare plan has that annual time to look around and figure out if they're on the right plan and make a change.
Yes.
And then after that, you have to have some sort of special circumstance, a special election to change. Yes. So now is the time, and if you're on a Medicare plan, you're probably receiving things in the mail. And we really encourage you to sit down with someone just like Leticia and make sure you get that quality service across the counter and kitchen table. But there's a lot of options. And United Healthcare, one of our strengths is that we have many different plan options. So we have a whole portfolio. So there's Medicare supplement plans that give you some freedom and flexibility to go to any physician you like. We have Part D plans that complement that. So
and to travel also.
Absolutely.
The Medicare supplement can be used across the country, all 15 states.
We got a lot of snowbirds here in the Phoenix area. We met one earlier today that, so a lot of folks that spend half their time in one part of the country and half their time in another, a Medicare supplement's perfect because their health care is portable. They can go wherever they like and have things covered. So we've got one of the largest Medicare supplement plan in the nation. Is with United Healthcare. Also the largest Part D plans, so you can get your prescriptions as well, so they're very popular.
What you guys are with, like, what are the pharmacies that you work with here in Arizona?
Wow, well, it's almost harder to think of, or almost easier to name the ones that don't accept United Healthcare.
Right.
So the network of pharmacies is really large.
Like
so
the top 5.
Everything from Walgreens and Rite Aid and CVS, all your major pharmacies, Good Neighbors, Fry's, their local supermarkets with a pharmacy, they're all in.
Walmart.
Absolutely.
Walmart.
So you can't use our plan at a VA center.
Right.
Or if there's a Kaiser location, but
right.
it'd be hard pressed to find a place that doesn't contract with us for pharmacy.
Love that.
So we've got all those Part D type plans and Medicare supplements. Now, for those folks that are looking to really get a big bang for their buck, we have Medicare Advantage plans, which are typically network-based plans, and that means that if you're in the Phoenix area, you need to be using those Phoenix-based physicians, and sometimes you pick a primary care doctor in those. And those plans, are 0 to low premium. You save a lot of money, and then you might pay a copay when you go see the doctor.
Right.
So those plans give you a lot more than original Medicare, even include many times prescription drugs right into the plan. So you have one plan, one card simplicity. So there's Medicare Advantage plans as well that are available, especially here in the Phoenix area. I mean, some of these plans have been around a long time, over 20 years. And then we even have plans just like that are designed for folks that have limited incomes. So people that are
special needs.
Special needs, absolutely. So one of them is a dual special needs program. That means that it's designed for someone that has Medicare and also Medicaid, or the Access program.
Access here in the state of Arizona.
Absolutely. So those folks, they really need help. And they don't know that they could actually afford quality health care. So when they join our plan and they became a full-fledged United Healthcare card carrying member just like anyone else, and they're seeing our top-rated doctors and getting the quality care. So the low-income community, or folks that are on Medicaid, we have an outstanding program for them here in Arizona through Maricopa, through Pinal, and down in Pima, down in Tucson.
I give it 2 thumbs up.
Yeah.
If I can say that, I just want to say it for the record. As an agent in the industry, the United Healthcare Dual Plan has helped so many of my clients that are low income, below the state poverty line, level, because they're, struggling already to, just pay their monthly bills. And I just hate when I have to find that clients have to choose between prescriptions and groceries. My light bill or my medicine, or being able to see my doctor because they can't afford the copays.
Absolutely.
And things of that nature. And I just want to highlight that, the United Healthcare Dual Complete Plan, it also offers some additional benefits, which are transportation, vision, over-the-counter catalogs, hearing.
Great dental benefit as well.
Dental is, oh my gosh.
It really wraps everything together, and these are folks that really need it. They're not activating in their own health care. So the plan is a coordinated care plan. It means that you've got doctors and everyone's watching out for you and helping you get healthier and giving you those extra services you need. So from a low-income community perspective, we're really focused on helping that population, stay healthy and get active in their health care, not just going into the ER when something goes wrong. We want people to thrive and be healthy.
I love it. Well, actually, you guys, we're going to wrap up the interview that we have here with Todd. It was such an honor to have him here. And just in case the community wants to know, I am a licensed agent here in the state of Arizona. So if you're interested in getting more information about the United Healthcare plans that are available here, you most definitely can reach out to me. My phone number is 602-730-2819, and my email address is innovativeinsuranceplans with an S@gmail.com. So thank you so much for coming on the show, Todd.
Thank you for having me.
Oh, and thank you so much for all that United Healthcare does for the community.